All right, so this is our first lecture about the hand, and in this lecture we're going to cover the hand osteology. All right, so this is an anterior view of the hand, and we're going to go through the carpal bones. So there's two rows of carpal bones, and we'll start over here towards here, and this is the scaphoid bone here. You often hear of scaphoid fractures. So this is the scaphoid bone here, and then this is the lunate bone here. Triquetrum is here, pisiform is here, so that's the first row. Then we'll go back over here. So just at the base of the thumb is the trapezium bone, then trapezoid bone, capitate, and then the hamate. And this structure that juts out of the surface here, this part right here, is the hook of the hamate. So that's the anterior view. All right, so now we're showing you a posterior view of the hand. We've just flipped it over, showing you the dorsal aspect. So we'll start here again. This is the scaphoid bone here. This is the lunate bone here. This is the triquetrum bone here. And then we'll start back over here again. So here's the trapezium bone here, the trapezoid bone here, capitate bone here, and then here's the hamate bone right here, okay? And again, there's no easy way. Unfortunately, this is one of the things you just got to memorize. You just got to memorize but I would break them down like how we did into the rows. 2 rows of carpal bones, and so I'd memorize them by the row. That kind of makes things easier. And one thing we'll point out here that this model shows very well is that the ulna doesn't really form any part of the wrist joint. It's the radius articulating with the carpal bones here. All right, so now we flipped it back over to the palmar surface here. And so we have our carpal bones here, and then just distal to that is the metacarpal bones. Now these are, they're considered long bones. They're small long bones, and they consist of a base here. These are prominences here, a shaft, and then a head distally. Now the heads help form the knuckles. So the heads of these metacarpals, they articulate with the base of the fingers here to form your first knuckles, okay? And what should be noted here is that the first digit's considered the thumb, the 5th digit's the pinky, and so each digit has its own metacarpal, as you can see here. So 5 metacarpals. Then you have the phalanges, which are these 3 rows of bones that help form each finger, and then you have two phalanges in the thumb. Okay, so it's an important distinction. And the phalanges, they're small, long bones, and they consist of a base, a shaft, and then a head as well, just like the metacarpals. One thing to also note is that the heads of the proximal and middle phalanges, so the heads here of the proximal phalanges here, and then the heads here of the middle phalanges here, they also help form your knuckles as well. Okay, and then just to review those joints again, so you have your metacarpals here and your proximal phalanx here. This is your metacarpophalangeal joint, so your MCP joint shown here in the thumb and then here in each of your fingers. So those are your MCP. Then you have your proximal interphalangeal joint, so the joint between your proximal phalanx and your middle phalanx, that's your PIP joint shown here. And then you have your distal interphalangeal joint, or DIP joint, and that is between the middle phalanx and the distal phalanx. So that is shown here, here, and here. And then in this joint, you have in the thumb, you have the carpometacarpal joint, which is between the carpal bones and the metacarpal. Then you have the MCP joint of the thumb, which is again just like in the fingers between the metacarpal and the proximal phalanx. And then in the thumb, you only have one interphalangeal joint, which is between the proximal and distal phalanx here. All right, so now we're going to talk about the components of the wrist joint. So it's also known as the radiocarpal joint, and that has to do with the bones involved in this articulation. So it's a synovial condylar joint formed by the radius, shown here, and the proximal row of carpal bones, which would be shown in here. So this articulation with an articular disc in between. So a disc shown here in between. The ulna is not considered a bone that is part of the articulation of the wrist joint, and so that is a fact to be aware of. So there's a few high-yield structures at the wrist joint that we want to cover. The first is the carpal tunnel, which is famously responsible for carpal tunnel syndrome. And what we'll talk about here is just strictly what is the carpal tunnel. We'll cover carpal tunnel syndrome in the clinical pearls section. So the carpal tunnel, it's a passageway on the palmar side of the wrist for the median nerve and tendons coming from forearm muscles, and you can see that here. The floor and the sides are kind of formed by these carpal bones in the wrist region here, and the roof is formed by this flexor retinaculum, which is this nice connective tissue band, and it attaches from the pisiform bone and the hook of the hamate. So it attaches to these two structures. This is on the ulnar side, okay? And then it kind of arches across like this And then on the radial side, it attaches to the tubercle of the scaphoid. Okay, so that has two attachments, and then the other one is it attaches to the trapezium. Okay, so 4 attachments: pisiform bone and hook of the hamate on the ulnar side, spans across the carpal tunnel, and then to attach to the tubercle of the scaphoid and the trapezium on the radial side. Now, what's much more high yield and really important is to understand the contents of the carpal tunnel. It's 9 tendons plus the median nerve, and the 9 tendons actually come from only 3 muscles, as you can see here. And that's the 2 major flexor muscles, flexor digitorum profundus, flexor digitorum superficialis, and then the flexor pollicis longus tendon. So here first we have the median nerve, and it's labeled here in the diagram and highlighted here in yellow. Then you have the flexor digitorum profundus tendons, so that's 4 of the tendons right here, and this is shown here. And this is obviously, this muscle is deep to superficialis, so this is going to be the deep 4 tendons here. Then you have flexor digitorum superficialis, which are these tendons traveling in here. And then lastly, you have flexor pollicis longus, which is labeled right here and coming in right here. So here's FPL right here for you. And what's important to note is that flexion and extension of the wrist both increase compression in the carpal tunnel. Okay, and so that's important for carpal tunnel syndrome because both those motions can potentially exacerbate someone's pain. Guillen's canal. So this is a separate canal for the ulnar artery and nerve to pass into the hand. It's a longitudinal canal. It's shown here. This would be kind of the outline of it right here. This would be your Guillen's canal, and this is your ulnar nerve and artery traveling here. The superficial palmar carpal ligament forms the roof of the canal, and that's this ligament shown right here, kind of translucent going over the artery and the nerve here. The flexor retinaculum and the hypothenar muscles form the floor, and you can sort of see that in this diagram here, forming the floor. And then it's bound medially by the pisiform and laterally by the hook of the hamate. Here's another good look of it here. Here's the ulnar artery and nerve about to enter into the Guillen's canal here. And one way just to draw this out here is you could think of it as you have the flexor retinaculum like this, okay? So that's the flexor retinaculum. We'll review that FR. Remember, that's the roof of the carpal tunnel. Then you have the ulnar artery and nerve traveling in here like this. And then over top of that, you have this superficial palmar carpal ligament, which goes over top. Okay, so that's forming the roof there. Okay, over the artery and nerve. So it's really the nerve and the artery travel between the superficial palmar carpal ligament, superiorly or superficially, and then they travel over the flexor retinaculum and the hypothenar muscles, which are deep to them. Next, the anatomical snuff box, very high yield topic for anatomy courses, anatomy exams. You could also potentially see this on a board exam question. So what is it? It's a triangular shaped depression on the lateral aspect of the dorsum of the hand. So here we have a nice picture of the dorsum of the hand. It's a triangular shaped structure, so we'll draw that in here like this. And its radial borders are the abductor pollicis longus and extensor pollicis brevis tendons. And that's these 2 tendons shown here on the radial or the lateral aspect. The ulnar or medial aspect is the extensor pollicis longus tendon, which is this tendon shown right here. So that forms the medial. And then the styloid process of the radius, which you can't see too well here because we have the muscles shown in the diagram, but that would be here. And then the floor would be the scaphoid bone, which is beneath or deep to these tendons here, and then the roof would be the skin. What's also really important is not just the borders, but there's structures that run through the snuff box. Is first the radial artery, so the radial pulse is palpable in the snuff box. Then you have the superficial radial nerve, which travels kind of superficially in this region like this as well. And then you have the cephalic vein, which is coming from the hand traveling back this way. Scaphoid fractures, they present with pain to palpation of the anatomical snuff box. And that's because the bone is just deep to here. The extensor compartments, these are something that's good to know for an anatomy exam. These aren't terribly high yield for board exams, but again, just for completeness sake, we'll go over them. So what are they? They're anatomical tunnels formed by fibrous connective tissue on the dorsal surface of the wrist. So here they are here. Here's these compartments, and they contain
anywhere from 1 to 3 tendons from forearm muscles traveling from the forearm through the wrist to the hand. And so you can see that here. This is the dorsal aspect. This is the palmar aspect. Here's the median nerve here, just before it's about to enter into the carpal tunnel. Here's ulnar artery and nerve here before they go into Guillen's canal. So let's go. We have a nice table here. This is in your book. We have the first compartment, which contains abductor pollicis longus and extensor pollicis brevis, and that's shown here. This is number 1. These two tendons traveling through this one right here. This is also the source of de Quervain syndrome, which we'll go over in more detail in the clinical pearl section. But this compartment is what's affected in de Quervain. It's inflamed, causing pain in the wrist region. Next, you have the extensor carpi radialis longus and brevis muscles, which are shown here. So this is compartment number 2. Then you have extensor pollicis longus, which is by itself, which is shown here. So this compartment right here, that's number 3. Then you have extensor digitorum, extensor indices, which are in this portion right here, extensor digitorum. This part right here, all the tendons of extensor digitorum are traveling through. You also have the posterior interosseous nerve, or pin, also traveling through this region as well. Then in the 5th one, you have extensor digitorum minimi, which is shown right here. So that's the 5th. That's the 5th tunnel there. 4th, and then you have extensor carpi ulnaris through the 6th and final. So right there. So this right here. All right, and that concludes our discussion of the hand osteology.